Do you know that colon cancer sometimes can present with silent symptoms that is not very common? Most commonly, people do colon cancer screening and they're looking for blood in the stool. But it's not always that colon cancer present that way. There is a hidden danger of colon cancer that everyone have to know, especially the silent symptoms that it presents. Now, just for your information, colon cancer, the prevalence of colon cancer in the United States alone is almost about 2 million every single year, and almost about a million people die from colon cancer. And actually, is globally is the third cause of cancer and the second cause of death from all form of cancer. So on this video, I'm trying to bring to you some of the silent symptoms that you should pay attention to if you or any of your family members or your close one have any of these symptoms. And there's a misconception that colon cancer cannot be found among the young people, which is very, very wrong. In this age, colon cancer can be found in anybody, especially if you have a family member. And therefore, early detection could be able to save your life or the life of your family member. So there are hidden symptoms of colon cancer that you should pay attention to. The first symptom is unexplained iron deficient anemia. This especially in postmenopausal women and also in the elderly. If you have an iron deficient anemia that cannot be explained, then you should go and get screened for colon cancer. The second symptoms that should alarm you is unintentional weight loss. All of a sudden, you're losing weight, something that you have not planned for, and you've done all the tests, they can find what is wrong with you. I think if you have unexplained weight loss, it's time to go and get screened because you may have early signs of colon cancer. Number three is changes in your bowel habits. Sometimes people can have constipation and it goes away, or just diarrhea and it goes away. However, if you have constant changes in your bowel habits, like just constipation all the time and alternating with diarrhea all the time, and you cannot explain it, then you should be alarmed and go in and get checked. Don't just go to the over the counter and buy medication to have a bowel movement, or if you have diarrhea to have, to stop the diarrhea, because this could be a sign that you are having early signs of colon cancer. And so early detection will help you. Now, especially you may not see any blood in your stool, especially if it's a right-sided colon cancer. You may not see blood in your stool. So even if you do the fecal blood test, you may come back negative. But if there is any changes in your bowel habit, that is a sign that you should go check for colon cancer. The last but not the least is unexplained fatigue. Unexplained fatigue can mean a lot of things, but if you have a history of colon cancer, family history of colon cancer, or you don't have family history of colon cancer, however, you have unexplained fatigue, that all the tests that has been run is not explaining what's going on with you, it could be a sign that you are having early colon cancer, and therefore early detection is going to help you. So I hope this information will be helpful to you, and I want you to share this information with our viewers. And also, if you know anybody who had any of these early signs and had a detection of colon cancer and therefore were able to save their lives, I want you to share this information on our comment section so that people can learn from this. Subscribe to my channel and also give us a thumb, and also hit the bell so that anytime we do a life-saving video like this, you'll be the first person to know about it. And come here weekly for your health tips that will save your life and the life of your family. Now remember, as I always say, in the 21st century, you are your own doctor. You know your body more than any physician. So if there's any changes in your body that is not right, go in and get checked. Early detection will always save your life. Until then, Dr. Moses I'll see you on the next episode.